Here is a comprehensive, detailed drug monograph for streptokinase. 1. Generic name, drug class, drug forms, brand names. Generic name, streptokinase. Drug class, thrombolytic agent, fibrinolytic class. Drug forms, lyophilized powder for reconstitution, intravenous IV solution after reconstitution. Brand names, Streptase, Hoaxed, Cabikinase, Cabifarmacia, Thromboflux, Case. Others may be available regionally. 2. Definition. Streptokinase is a bacterial-derived thrombolytic medication used to break down or dissolve blood clots. It is classified as a non-fibrin-specific plasminogen activator, and it is mainly used in life-threatening thrombotic conditions such as myocardial infarction, pulmonary embolism, and deep vein thrombosis. It is obtained from group C beta hemolytic Streptococcus bacteria. 3. Mechanism of action. Streptokinase forms a 1-to-1 complex with plasminogen, a precursor to the enzyme plasmin. This complex triggers a conformational change in plasminogen, activating it to plasmin without proteolytic cleavage. Plasmin then digests fibrin and fibrinogen, breaking down the matrix of blood clots. Streptokinase also degrades other clotting factors such as factors 5 and 8, further contributing to systemic fibrinolysis. Key features: non-fibrin specific, may lead to generalized fibrinolysis. Immunogenic, antibodies can form, reducing its efficacy if used again within 6 to 12 months. 4. Indications. FDA approved and common uses. Acute myocardial infarction. Within 12 hours of symptom onset. Pulmonary embolism, especially massive or life-threatening cases. Deep vein thrombosis, DVT. Acute arterial thromboembolism. Occlusion of indwelling central venous catheters or cannulas. Peripheral arterial occlusions. 5. Contraindications. Absolute contraindications. History of hemorrhagic stroke. Ischemic stroke within the past 6 months. Active internal bleeding. Suspected aortic dissection. Recent intracranial or intraspinal surgery or trauma within 2 months. Intracranial neoplasm or AV malformation. Severe, uncontrolled hypertension. 180-110 millimeters. Known hypersensitivity to streptokinase or prior administration within the last 6 to 12 months. Relative contraindications. Recent major surgery, 10 days. Recent gastrointestinal or genitourinary bleeding. Recent trauma, especially head trauma. Active peptic ulcer. Pregnancy or postpartum, 10 days. Diabetic hemorrhagic retinopathy. Current use of anticoagulants with high INR or APTT. Saw 6. Before taking this medicine, precautions. Medical history check. Stroke, bleeding disorders, recent surgery or trauma, ulcers, hypertension. Allergic risk. Prior exposure to streptokinase increases risk of severe allergic reactions. Pregnancy. Category C. Use only if potential benefit justifies the potential risk. Breastfeeding. Unknown if excreted in breast milk. Use with caution. Immunogenicity. Avoid repeat use within 6 to 12 months. Monitoring. Coagulation profile. PT, APTT, fibrinogen, CBC with platelet count, ECG and vital signs, signs of internal or external bleeding. Administration. Venous, IV infusion. Setting. Must be administered in a hospital with emergency resuscitation equipment available. Preparation. Reconstitute lyophilized powder with sterile water. Do not shake vigorously. Gently swirl. Administer immediately after reconstitution. 8. Dosing information. For acute myocardial infarction, AM, 1.5 million IU infused IV over 60 minutes. For pulmonary embolism, loading dose, 250,000 IV over 30 minutes. Maintenance dose, 100,000 IU per hour for 24 hours. For deep vein thrombosis or arterial thrombosis, same as PE protocol, but continued for 48 to 72 hours, depending on clinical response. For occluded catheters, instill 250,000 IU into catheter, let dwell for 2 hours, then aspirate. 9. Misdose, overdose. Misdose, not applicable, administered in a monitored setting. Overdose may result in severe bleeding, hypotension, allergic or anaphylactic reactions. Treatment, stop infusion immediately. Administer blood products, fresh frozen plasma, cryoprecipitate. Use antifibrinolytics, e.g. aminocaproic acid or tranexamic acid. Support blood pressure and airway. 10. Stop or avoid taking. Discontinue immediately if life-threatening or uncontrollable bleeding occurs, evidence of stroke, especially hemorrhagic, develops, severe hypotension persists, allergic or anaphylactic reaction is observed. Avoid future use if Streptokinase was used in the past 6 to 12 months. Patient has developed anti-Streptokinase antibodies. Hull 11. Side effects in detail. Very common: bleeding, gastrointestinal, intracranial, urinary puncture sites, hypotension, often transient and mild. Common: fever, chills, nausea, vomiting, rash or urticaria, chest pain, back pain. Less common but serious: hemorrhagic stroke, anaphylactic shock, reperfusion arrhythmias, especially after MI, angioedema, bronchospasm. Immunologic reaction occurs due to prior exposure to streptokinase or Streptococcus antigens, may cause resistance to therapy or allergic responses. 12. Vital information, not fibrin specific, higher bleeding risk compared to TPA, tissue plasminogen activator. First generation thrombolytic, cost effective but less selective. Single use only, avoid repeat use within a year. Requires close monitoring during and after administration. Always use in conjunction with ECG, BP, O2 saturation, and lab parameters. 13. Other drugs that will affect streptokinase. Increased risk of bleeding with antiplatelets, aspirin, clopidogrel, prasugrel, ticagrelor, anticoagulant, warfarin, enoxaparin, dabigatran, NSAIDs, ibuprofen, naproxen, diclofenac, other thrombolytics, alteplase, TPA, retaplase, tenecteplase. Interactions to monitor: ACE inhibitors, risk of hypotension, nitrates, additive hypotensive effect. Recent vaccinations or antibody therapies may influence immune response to streptokinase. Thank you. Have a nice day.